Hi guys, welcome back to my YouTube channel. I'm Dr. Fatma Salim. Today I'll be talking about low sexual desires, also known as low libido or hypogonadism, if in men and all that. There are several factors influencing low libido. Some of them are medical issues, and it could be due to maybe social issues and all that. Yeah. It, for both genders, it could be because of a relationship issue. Maybe someone has had a conflict with their partners and all that. It could be due to stress, anxiety, or depression. Someone is undergoing something, maybe a family issue, or maybe you know um, job issue or other stress, other factors that could influence stress and all that. So all this combined, someone gets to be so focused on the problem, thus they get to have low sexual performance. And it could be due to erectile dysfunction in men, and sometimes due to vaginal dryness in women. And again, women sometimes, especially when they are pregnant, they are a bit withdrawn when it comes to sex. And again, some women, once they have a baby, they tend they get to be so stressed and like tired and all that, with a new baby and all that. So, and some factors are actually not so much of factors, I mean, to influence a low sexual desires, but some men, due to peer pressure, they tend to, some men or women, let me not be biased in this, so both men and women, sometimes due to peer pressure, they tend to believe that they have low sexual desires or performance compared to their fellows, to their colleagues, or I mean, to their friends and all that. I remember in my practice a few years back, literally in our line of work, we get to have very interesting cases sometimes. So this time I had this young man, I think around 17, 18 years old, who came in. And when a patient comes, you're expecting other stuff, like you expect someone will present with the symptoms of a disease, and you treat them and all that. Yeah. So this young man came in, he sat down, and when I gave him an ear, uh, his main concern was that his friends could go up to 7 rounds, but he could not, sexual wise, yeah. And he was so concerned that he could not go 7 times. I just looked at him and I was like, wow, I had actually thought that this guy came here out of health concern and all that, and he's talking about 7 rounds and all that. So at first, I really misjudged him, and I was like, wow, uh, why would? Anyways, I thought I misjudged him, to be honest, and I thought, like, it's not an issue, it's not a problem. Why would he come to me because he could not go? He could, yeah, for 7 rounds and all that. So literally, it was an issue for him, and it was really bothering him to the point that he came and opened up to me. It's very difficult, especially in our culture, for people to open up about such things. To go and tell somebody, I cannot perform well and all that, because of our cultural beliefs, cultural yeah, issues. We cannot, people cannot be open. So when, for him to come and open up to me, it seems that it was actually an issue for him, that he had to look for help and all that. Anyways, that was one example of a peer pressure that people get to give each other, and make others believe that it's an issue. They have an issue while they don't. Going 7 rounds, 10 rounds, and all those rounds. Okay. On my part, I don't think it should matter. It's not an issue. It's not that he could not perform. He can perform, but going 7 rounds and all that, sometimes people tell you things while practically they don't get to do them. They don't get to perform them. They set challenges or goals for other people, but they themselves cannot do that. So anyways, so sometimes people get to be pressured by others to do things. So there are those issues as well. Men or women tend to believe that they perform less and all that, while they're actually good or in level with performance. And I've heard men, grown-up men as well, approaching me about the same issues as well, not about 7 rounds and all that, but low performance and all that. So to say, this is actually a big problem in our societies. It's a big problem. It's just that people don't come out clean to talk about it. But because of this, there has been a very high mortality, because people get to look for sexual enhancement drugs. They use them, and some have been, and we've had cases of others undergoing a heart attack, and they pass on just like that, because of I don't know, people believe they cannot perform, so they end up looking for enhancements, so they take enhancing drugs, sexual drugs, in order for them to perform well, while they end up losing their lives. So I thought I should bring about this topic so that people can understand, that there are sometimes, like, it's not because one cannot perform, but there are some factors that influence and cause one not to perform well. Apart from looking for sexual enhancement drugs, there are actually herbs. There are some type of foods that can help one, that can help enhance one's desires, and one can actually perform well and all that. So I thought this is one issue that needs to be aired out, so that people may understand that, if you are having relationship issues, and then you go and have sex, definitely for some people they cannot perform. For others it's actually a sexual drive. They get to perform better than when they are not fighting. But for others, it usually causes low sexual desire. So people should wait until when they've sorted out their issues, until when they've calmed down, then they can actually engage in sexual issues. I mean, yeah. And for some others, those that are having stress, anxiety or depression, yeah, that could actually be the reason as to why they perform less. So they can actually seek for, they can wait until when they're okay to do it, and those that are pregnant and all that, this is very much understandable. Can take your time, relax and all that, and then when you're okay, when you're less tired and all that, you can perform. And other issues, other factors that could influence that are use of certain drugs. There are some drugs that literally decrease sexual libido. So one can wait until when you are through with the medication, then you can actually continue. But all in all, if you think that you have a medical problem that is causing you to have low performance, then you should actually visit a doctor, a special doctor for that area, and you can have a talk. You can be investigated and probably get the accurate type of help that that would help you around. I remember there was a time we used to host some like we used to have some dinners or lunch. We used to host it in, I don't know how to put it, but regularly, like in turns, so to say. Yeah. So it was my turn, and I didn't have anything much, to share with others. So I thought, let me just go to the market. I'll grab some vegetables I can come and make with ugali or something like that. So as I was in the market, I saw I saw ginger and some unripe mangoes and all that. So I was like, I can probably make juice, with this and all that. So I did that. I made ugali with vegetables, and that juice made of ginger and unripe mango. Fortunately, the following day, people were in my office, and they're like, "Doc, what did you put in our drink yesterday?" Then I was like, "What did I put?" I didn't put anything, because I truly did not thought or think that that drink could have such an effect, you know. So, and then they were like, you know, we could not sleep the whole night, you kept us awake and all that. So I was like, wow, I didn't even know that it had such an effect. But if it has such an effect, then it's a good thing to know, you know. So yeah, so ginger and mango, you know, you can make juice. It helps a lot for people and all that. You can try that. And there are other herbs, Swahili herbs, or some type of seafood, you know, like you can make soups of prawns, octopus, and squid, and all that. These usually are known to increase sexual desires for Swahili. They are known by Swahilis to increase sexual desires and all that. One can try those rather than literally rushing to use these medication, which could cause some issues. We've had cases of people who have been found dead in motels, in hotels, or in their houses because they were trying to enhance their sexual desires. So anyways, I thought I should bring this up for people to be cautious and to know that, you know, it's not that every time one has low libido or low sexual desires, it's a health issue. Sometimes it's because, you know, one is not focused to that, and one has some other issues, you know, to sort. So sort those issues first before you engage into sexual activities, sexual affairs. Anyways, thank you so much for listening. Kindly give me thumbs up and subscribe to my channel so that you can help me, you can help the channel grow, and you can help this knowledge reach out to a wider range of people. Thank you so much. Till next time. Bye.